would like to introduce Director Dave King with HIDTA.
Good morning. Thank you for joining us. My name is David King, and I'm the director of the San Diego Imperial Valley High Intensity Drug Trafficking Area, otherwise known as HIDTA. It has been almost 2 years since California allowed for recreational marijuana use following the passage of Proposition 64 and the implementation in January of 2018. To measure the effects of the significant policy change, the 4 California high-intensity drug trafficking areas produce an annual report with data from a variety of sources. The 2020 report includes data from over 30 different sources. With consistent data collection, community members and policymakers can better understand the implications and effects of marijuana's increased presence in California. Specifically, data can be useful in identifying trends among youth so that prevention campaigns can be developed. Some highlights from the new California Marijuana Impact Report include a dramatic increase in potency. And you're going to hear from some of our speakers, leaders in the field, subject matter experts about the potency. The primary psychoactive ingredient in marijuana is THC. There has been a 350% increase between 1995 and 2018. Additionally, marijuana concentrates can contain up to 90% THC, tetrahydrocannabinol. We're experiencing an epidemic in youth vaping. The most recent findings from the Monitoring the Future survey indicated that the largest single-year increases in adolescent marijuana vaping ever recorded in the survey's 45-year history. Statewide emergency department data indicate a continued increase in marijuana-related visits. From 2016 to 2019, California emergency room visits and administrations for related marijuana misuse has increased by 89%, extremely alarming. Marijuana remains the primary drug of choice for youths aged 12 to 17 entering treatment. And finally, the newly formed Bureau of Cannabis Control needs to be an active partner in conducting proactive prevention efforts aimed at youth. These are just few of the many points that this report provides, and I hope all of you will have a chance to read California's 2020 Marijuana Impact Report. Now, I would like to call up Joe Eberstein with the San Diego County Marijuana Prevention Initiative.
Thank you, Director King. Good morning, everyone. I am Joe Eberstein with the San Diego County Marijuana Prevention Initiative. The Marijuana Prevention Initiative published a San Diego County Marijuana Impact Report in May, focusing on youth impacts of marijuana use. What we are seeing at the local level mirrors what is seen in the state level HIDTA report. Vaping continues to be a big issue locally among our youth. All grades reported increases in use of vaping devices for marijuana consumption. We also had 62 local cases of e-cigarette and vaping associated lung injury, one of which resulted in death. Most cases have been linked to THC-filled cartridges. Marijuana is the primary drug of choice for youth ages 12 to 17 in county-funded drug treatment. In our local hospitals, emergency room discharges related to marijuana use have increased 776% between 2008 and 2018. If you break that number down even further, it comes to about 29 ER discharges a day. Since 2011, poison control calls related to marijuana use have increased 180%. Lastly, it is imperative that municipalities maintain the level of local control provided under Proposition 64 so that they can divide how much access to this drug they will allow. Now I would like to introduce Dr. Cindy Burke with SANDAG.
Thank you. While many measures of substance use rely on self-report data, as part of the SANDAG Substance Abuse Monitoring Program, or SAM, San Diego County has an objective measure of drug use over time. Our data show that over half of the youth booked into juvenile hall in 2019 tested positive for marijuana. 92% reported they had ever tried it, and 58% said it was the drug they had first tried even before tobacco and alcohol. We also know that fewer youth today think marijuana is harmful compared to decades ago, and youth who have used it in the past 30 days report doing so every other day on average. For adults in the justice system, legalization has not changed their purchasing behavior significantly, with around 2 in 3 reporting they still bought it on the street, a similar proportion that also bought it at recreational dispensaries. We also know that half of adults don't think marijuana will impact their driving, and almost half of these individuals report doing so in the past 12 months. Marijuana is more potent than ever and easily available. And our data also show that while 2/3 of adults think it is psychologically addicting, less than half of youth do so. These data are important indicators about changes in youth perception and use since marijuana has become legally available, and the importance of prevention and education across our region. I would now like to introduce Dr. Roni Lev.
Hi, thank you. The Marijuana Prevention Initiative and HIDTA report card tell the story in numbers about what marijuana is doing in our community. As an emergency and addiction physician, let me share some frontline marijuana cases in real people. I treat marijuana poisonings every day in the emergency department, every day. A 54-year-old woman who passed out, splitting open her scalp. She required multiple stitches after eating a single pot gummy bear. She took it to treat her headache. A 25-year-old admitted to the mental health unit with severe paranoia while using marijuana she thought would help her relax. Instead, it sent her to the emergency room. Code trauma, code trauma, code trauma. That is a sound from the overhead hospital speakers before a traffic accident involving multiple people where the driver was taking medical marijuana. Even during the peak of our pandemic, when people were scared to visit the emergency department, I can hear screaming, retching, and agony from a person with cannabis hyperemesis syndrome, what we call scromiting, screaming and vomiting. I treated a man with back pain who was so proud of his medical marijuana card and how he was avoiding opioids by vaping. But his blood pressure was critically high, 240/120. And he confessed that his cannabis doctor never checked his vital signs. Anyone interested in medical marijuana should read the warning from the American Heart Association, urging an educational campaign on the harmful effects of marijuana on the heart. And all too common are patients who come in with excited delirium, a violent medical reaction to drugs. After controlling the situation, if one particular young man I found was tested positive only for THC, the psychoactive chemical in marijuana. And can we really call it just THC or just marijuana for such a frightening reaction? We are alarmed, as we should be, by the fentanyl crisis taking precious San Diego lives. And when I talk to patients who've survived a near fatal overdose, almost all tell me that their path to drugs started with marijuana at a very young age, 12 and 13. Make no mistake that marijuana is addicting and hurting our youth. Addiction is 4 to 7 times higher for people who start using drugs before their brain is finished growing at age 25. And 9 to 50% of people who use marijuana develop an addiction. I do not want to pass judgment on people, but I do want San Diegans and Americans to make informed decisions that include the real risks of using marijuana. Thank you. And I will now invite the next speaker.
Patrick?
Hi, everybody. I think we can all agree that having youth access such potent marijuana products are dangerous, yet in my experience, it's happening. As we stated previously, marijuana is the primary drug of choice for youth in county drug treatment facilities. And cannabis use disorder is a medical term for people that have trouble controlling their use. We see an inability to associate the use with any harms. This prolongs seeking help, and use starts causing relational and employment issues, as well as an overall detouring quality of life. In my 17-year experience with McAllister, it troubles me to see the link between marijuana and mental health issues, which are often intensified by the pot use. So the good news is there's support and treatment available. This group will continue to monitor trends and encourage the Bureau of Cannabis Control to be more of an active partner in prevention. So that concludes our news conference. The participants will remain if you have any further questions.
Thank you, Patrick. I want to invite anyone or any media that have any comments can either ask it in the chat or can just ask